Welcome back. Now, yesterday, Namibia officially confirmed its first case of Mpox, prompting the Ministry of Health and Social Services to declare an outbreak. The announcement has raised public concern and curiosity about what this means for the country, how the virus spreads and what preventative measures citizens should take. And to help us understand the situation better and outline the ministry's response, we're joined by the Deputy Executive Director at the Ministry of Health and Social Services, Dr. Theo-Ben Kandetu. Dr. Kandetu, good evening. Thank you so much for joining us here on the Daily Roundup.
Yes, good evening. Good evening. Thank you so much for having me.
Well, Doctor, to start with, for those who may not be too familiar with the topic of discussion, yesterday it has been confirmed that we had our first case of Mpox. And today it's seemingly, I think, due to panic, we've been seeing different reports that there's now 44 cases and another report saying that the ministry has only officially announced one additional case. So what's the status quo there?
Yes, many thanks. I think it's good that you've allowed me to just set the record straight. The earlier reports that were not correct, reporting that the ministry has reported, 44 cases of Mpox is not correct. And I think the ministry has already set the record straight in that regard. So has the Minister of Health and Social Services in Parliament this afternoon. So indeed, the ministry has only reported 2 confirmed cases of Mpox. So as of the 21st of October, which is today, we've identified an additional confirmed case, which is related and is a close contact of the initial case that we identified and that we confirmed on Sunday when the outbreak was declared. And so the 2 patients are currently being isolated at a hospital in Swakopmund, and they are recovering quite well. We have also embarked on robust contact tracing measures to identify contacts and if they are symptomatic to swab them and test them and isolate them appropriately.
Fantastic. Thank you so much. Well, on to the actual virus, Mpox. Talk to us about, explain to us rather what Mpox is and how this virus differs from other infectious diseases.
Yes, thank you. So Mpox, first and foremost, I think it should be said it's not a new virus, right? It's an outbreak. It's a virus that has caused outbreaks for a number of years, and so it's essentially a viral illness of zoonotic origin. So what that means is it's a zoonotic disease, which means it can spread from animals to humans. Although the current, global outbreak that we are seeing is primarily human-to-human transmission. So it's caused by what we call the Mpox virus, and it's quite similar, or it's related to the virus that caused smallpox. Although, of course, Mpox is significantly much less severe than smallpox, which has been eradicated some decades ago. So with respect to smallpox symptoms, they usually last about 2 to 4 weeks. And then most of the cases are mild. So which means, it's quite mild symptoms that wouldn't require hospitalization. Although sometimes there could be individuals that could become sick and that require hospitalization. Those who are, I think, most at risk, I would say, are children, pregnant mothers, and individuals with compromised immune systems. So I think, in a nutshell, that is, what I can say on what Mpox is.
Well, that's good to know that it's much less severe than smallpox and actually very mild. But that takes me to, the common signs and symptoms that we could be possibly looking out for. What are those?
Yes. So the most common one, I think, would be a rash, right? This is a skin rash that appears some days after the onset of other symptoms. Other symptoms like headache, muscle aches, fever, and fatigue. So this skin rash, it typically would be concentrated on the face, or on the palms of the hands, or on the soles of the feet, and would also turn into blisters, and then over time, as the rash heals, it then becomes crust-like. So the rash could also be, found over the mouth, over genital areas, and also the eyes may become affected. And as I said, the symptoms usually last about 2 to 4 weeks. And during this time, a person can transmit the infection to others. Yes, so not everyone will experience all these symptoms, so it may vary from individual to individual.
Infection is transmitted person to person. So is this through the touching of the skin, through sharing a cup of water? How exactly would that happen?
Right. So with Mpox, the spread will occur through close contact with someone who has the virus, so that's someone who is infected. And this can occur through direct contact with infectious skin lesions or body fluid. So you are correct. It can be contact through either face-to-face or skin-to-skin or mouth-to-mouth or even mouth to skin, and we've also seen, that infection transmission could also occur through respiratory droplets. For example, if someone coughs. But the main risk factor here, I would say, really is just close contact with an infected person, or even with contaminated materials that have been contaminated by an infected person.
At the beginning of our conversation, Doctor, that the 2 patients that have been confirmed to have Mpox have been isolated. I want to know what treatment options there currently are for Mpox.
Okay, so treatment for Mpox, it focuses primarily on managing the symptoms, right? We say that the virus is self-limiting, so which means there's no real sort of cure or treatment that you can use to expunge or to eliminate the virus. Rather, treatment is more geared towards managing these symptoms. So this would include, for example, if a patient has fever or pain, then we would give medication to manage the fever. We would give medication to manage the pain. And I think with this, it's also important to ensure that the patient has a balanced diet, so is eating correctly, making sure that the patient has adequate nutrition, and then also making sure that the patient is adequately hydrated. So ensuring that the patient drinks lots of fluid, and then with that also caring for the rash lesions to prevent secondary infections like bacterial infections. There has been quite a lot of talk around some antiviral medications that could be used to support the treatment of Mpox. And I think, for example, one of those antivirals that have been discussed in literature is one called tecovirimat. However, this is considered more for severe cases, so this is hospitalized cases, severely ill. But also having said that, the literature that's out there is to support its use is still quite limited, and it's still evolving. So this is something we are still looking at, but at this time, we would not advocate for its use until we are more certain of its efficacy profile in our population. But like I said, by and large, most of the cases will be mild to moderate, actually mild. And so the treatment is geared more towards managing the symptoms.
Thank you.
And then just a quick one with respect to the severity. I think depending on the severity, most patients with Mpox, should be isolated either at home, or if they require hospitalization, of course, they would be hospitalized in an isolation ward under strict home assessment, and ensuring that they comply to strict infection control and prevention guidelines.
Dr. Kandetu, it's been so insightful speaking to you. Thank you so much for your time this evening and joining us here on the Daily Roundup.
Thank you so much for having me.
That was Dr. Theo-Ben Kandetu, the Deputy Executive Director at the Ministry of Health and Social Services, giving us an update on the Mpox matter within the country. We'll be right back.